Hello, and thank you for joining us for the Women Veteran Town Hall at the Atlanta VA. Today's Wednesday, September 17th. We're so glad that you joined us, and I'm going to go over some of the admin notes briefly. First of all, thank you for your service and for participating in our town hall. It's really important to us that our women veterans have an opportunity, and we do this twice a year just for the women so that they can be sure that their gender-specific questions get addressed. We're meeting here in person at the Pete Wheeler Auditorium and also on MS Teams. There will be a question and answer session after these presentations, and if you're a part of our audience on MS Teams, please place your questions into the chat. Since this is a public forum, please refrain from sharing personal healthcare information in your questions. We want to protect your privacy. And a recording of this town hall will be posted on the Atlanta YouTube page for those who have missed it. And there'll be lots of information on there as well, in case you can't remember some of the contacts or QR codes or things like that. So this is our agenda. We're going to talk about the women's program. We have VBA here to talk about some of their newest updates. We have comprehensive care and primary care discussions, maternity care, reproductive health, and some research. Then afterwards, we'll have our question and answering time. I did want to introduce our director, Mr. Kai Metzer, for those who didn't know, and I believe he's online. And here's our executive leadership team. So these are our powers to be. We do have Dr. Norvell, who is the chief of staff, who is over the women's program, and he is here. Dr. Norvell, would you like to say your hellos?
Hello, everyone, and thank you for attending. Also, thank you, Ms. O'Laughlin and Dr. Pittman, for being here. This is the highlight of, the activities that I have every quarter when we do this. So I'm so happy to be here, and I will make myself available. Thank you.
Thank you for your ongoing support. He shows up to all of the things that we do, and we really appreciate that. All right, so I'm Kathleen O'Laughlin, and I'm the Women Veteran Program Manager here at the Atlanta VA. Every VA has one Women Veteran Program Manager, and the goal is to really educate veterans and staff about gender-specific care that is getting addressed at the VAs and to ensure that programming meets the needs of our women veterans. One thing that's really helpful is this call center call. This is the national call center, and you're able to text them, use the QR code, or call them. They have extended hours, and so if you're new to wanting to get set up to VA services, they're great to be able to tell you where to go, and also if you want to request follow-up services. So they are a great resource, and we have magnets here as well for folks that are interested. On the back table, we have a lot of resources. One of the other resources we have is the Pink Did You Know cards, and it's a one-stop shopping so that you can see the different services that are offered to the Atlanta VA women veterans in maternity, reproductive health, mammo and cervical cancer screenings, birth control, information about menopause, nutrition. If you look at that QR code, that's the national site for information, all things women veteran health related. So it's really a great resource. And our women veteran staff created this just because these were the numbers that they frequently got asked about. So they have the crisis line, they have My Healthy Vet information, call center, the contact hub. So it's a great place to be able to get all those questions answered as well. So the Women Veterans Program here, we aim to provide our women veterans with high quality comprehensive care and gender specific services. And we really are aware of the unique needs and challenges faced for our women veterans, which is why we carve out this time for our Women Veteran Town Hall so that we'll have enough time to address these gender specific issues. And when you hear the women's program, our goal is to really work with all of the VA resources, and so comprehensive care within the Women Veteran Primary Care team, and that's to make sure that when our women veterans see their primary care providers, they're able to get their gender-specific services addressed as well. So women who need their breast and gynecological care or maternity care, infertility treatments, those are specific extra gender-specific care needs that our women veterans have. So when you talk to your primary care providers, you can ask them for consults, or you can talk to the women's program, and we can give you more information about that. And right now, we're serving more than 28,000 women veterans. I looked today, and there were 28,977 women veterans enrolled at the Atlanta VA, which is phenomenal. And it's the highest number of women veterans at any VA in the nation. So we are really impressed with our numbers that are rising, and we really want to hear from our women veterans. And that's why town halls and focus groups are important, so that we ensure that we hear you and we're getting information about what your needs are. When you hear about the Women's Wellness Clinic, that's one primary care clinic. So our women veterans can get their care anywhere at any CBOC, any community-based outpatient clinic. But there's one that is a primary care clinic just for women, and that's located over at Arcadia Ave, the AVC clinic. And the reason why those are specific Model 3 clinics is because they have their own entrance, it's a dedicated space, their own waiting room, and it's for women veterans who feel more comfortable being in an environment with just women veterans for privacy and comfort. And then there's a new campaign coming up that women veterans belong at the VA. And so here is some flyers that you'll be seeing, and we're happy to share that with you. We really want our women veterans to feel that we're here for them and that their care needs will be met here at the VA. So our first speaker is going to be Mr. Chris McCarriges, and he is from, I mispronounced his name like 5 times before, so I nailed it, right? All right, he works for the VBA, and so he is here to share some exciting new information for you all that have questions.
Hey, good evening, everybody. Again, I'm Chris McCarriges. I am the public contact coach for the Atlanta Regional Office. We're the Veterans Benefits Association, so we're kind of the other half of the VHA. We kind of get you on your life support and stuff there with compensation claims and different things we offer there. I know recently in the past few years we rolled out the PACT Act that's kind of opened up more people to be to give you guys the ability to get service connected for certain issues that before were not considered presumptive. Now we've got things to where maybe if you didn't have an issue in service, but now you have a condition that's come along, we're able to get you service connected for that and get you some sort of monthly compensation to kind of offset the any way it would impact your employability stuff. But again, we're over there at the public contact. I've left 2 flyers in the back here, and then I'll make sure I get over to Miss was it Kathleen? Did I get it correct? Yes, I'll get you the flyer for the QR code because we offer virtual and in-person appointments, but you can make those appointments online and kind of skip the wait for coming in our public contact office because, you know, we do kind of, depending on the workload and, you know, how many veterans we see in the day, it can get a little backed up over there. But we offer that virtual option for people that maybe can take 30-minute break from work and you've got you got questions about other benefits we can offer or questions about claims you have pending. And again, we really are kind of leaning into this outreach, which is our new model the VBA is going towards with claims clinics and, you know, trying to come to the veterans that can't get to us. Over there in the VBA, which we're directly across the street from the main hospital here, we have MST coordinators. You know, that's the anybody that's gone through any kind of trauma or anything while in service. We have 2 dedicated female public outreach specialists that are there to take care of you and answer any questions and help guide you to that. We also have homeless coordinators. We have suicide prevention coordinators over there. Kind of anything that we can do on our side that isn't direct medical care, but we have people that can point you in the right direction to help you with anything outside of what the VHA can cover, any assets or anything we've got. Other than that, we're open, you know, Monday through Friday. We're there. We start at 8 and end at 4. But anybody that wants to come in and see us, you know, we're available, but we'll get you the QR code to be able to do any virtual clinics. Other than that, there's nothing super new that's come out for the VBA in the past year for us, other than the PACT Act was our big one. But again, we're there. I'm available for questions. My information's on there, I believe. But if you guys have anything that you need, just let us know. And then I'm going to run back over to the office after this, and I will get that. If we could get that put into the chat, if someone could do that for me. But I'll be available. I won't be able to answer questions this evening, but I can get back to anything you have. If you get it to me, I can get it out to them and get you an answer for it.
Great, and if people put in, questions for Chris in the chat, we'll make sure that they get
Perfect, thank you, I appreciate it.
Excellent. Thank you so much. And this is great. I love that people have the QR code and they can just set things up. Oh, we did have a question, so maybe if it's something other people can benefit from. Okay, we had a question about the QR code and how to set things up, so we'll make sure that we share this in the chat so that people that are not here in the auditorium have access to that.
It is in the chat now.
Oh, Mike Daly, thank you for being so prompt. Okay, our next speaker is Dr. Jamia Pittman, who is the medical director of the Women's Program. And so here she is.
Thank you, Kathleen. Okay, thank you everyone for being here. Thank you to those who are joining us online. And we're delighted to be able to present a little bit of information regarding how we take care of women veterans. I just wanted to highlight some key elements regarding comprehensive women's health and primary care. So the Atlanta VA is committed to addressing all preventive health measures for women across the spectrum and the seasons of life, across the spectrum of age and the seasons of life. So that includes breast cancer screening, cervical cancer screening, colon cancer screening, and vaccinations to prevent illness, osteoporosis screening, and screening for sexually transmitted infections, to name a few. And I just included this slide because it's really important that we focus on staying healthy. We want our women veterans to know what it takes to stay healthy. And so for the FY 2026 season, we're really going to focus largely on prevention and staying healthy. Many people do not know, but the VA exceeds other sectors in breast cancer screening. And so this slide depicts the VA rate of screening at 82.9%, HMOs and PPOs at 73%, Medicaid at 52%, and Medicare at 71%. And I included this slide because we need to know that, because we need to be proud of that as a veterans organization. And the Atlanta VA is committed to contributing positively to that metric by screening our women veterans. Right now, all of our breast cancer screening continues to be in the community, but we look forward to on-site mammography pretty soon. We also have a team of navigators. Whenever you are screening for cancer, you want to make sure that if cancer is diagnosed, you know what to do next. And we find that the best way to know what to do next is to pair you with a navigator, a nurse practitioner or an RN that can call you and walk you through the steps of getting to that next step, whether it's a biopsy or treatment, chemotherapy, radiation, whatever is needed. And that person holds your hand and helps you to get there. So we have a team of 4 navigators, and they do just that. They bridge the care coordination between you, the patient, the PAC team, and the community. In addition to routine breast cancer screening, I wanted to highlight the importance of screening related to potential military exposures, exposures or exposures that are acquired as a result of you being in the military, certain exposures, and I'll explain those a little bit later. There is the Service Act, and it's a clinical reminder that your primary care team provider is dedicated to completing. I want you all to know about it as patients because you can also help to advocate for completing of this clinical reminder by asking for it. And basically, this reminder helps to understand if you've been exposed to environmental toxins like burn pits, and helps us guide you through the questions necessary to determine if you're early risk. And if you are, we want to screen you before the age of 40. Right now, the screening guidelines recommend screening at the age of 40 and above. But if you've had these particular experiences, we want to screen you before that. And those experiences are military exposure to environmental toxins, specifically burn pits, and also high-risk family components that put you at risk for breast cancer. This Service Act was signed into law in 2022. It's kind of like the PACT Act, but it's called the Service Act. And it was inspired by Dr. Kate Hendricks Thomas. She was a Marine veteran, and she was a public health professional. And she was exposed to burn pits during her deployment in Iraq on a daily basis. And she was diagnosed with stage 4 breast cancer at an early age in her late 30s and passed away at age 42. And so based on that, Congress decided to expand mammography screenings to those who have served in key areas where burn pits were present. And that includes Iraq, Southwest Asia, Afghanistan, Djibouti, Syria, Jordan, Egypt, Lebanon, and Yemen. And so this just highlights the importance of us understanding not only the cancer screening recommendations for women in general, but also being able to understand military-related cancer screening recommendations for women veterans. The next area of focus that I highlighted today in this presentation is cervical cancer screening. It is recommended that we start screening individuals at the age of 21 and up to the age of 65. And we just want to let you know that each CBOC has 2 women's health providers at minimum. Some have even more, but 2 women's health providers capable of performing trauma-informed pelvic and cervical cancer screening examinations. And we also understand that some of our veterans participate in dual care, meaning they get care at the VA and also outside of the VA. And if you are participating in dual care and you get your screening outside of the VA, we need to know about it at the VA so that we can record that in your record and keep up with when it's due again. And to record that, we need the result, preferably. But if we don't have the result, that's okay. Written down, that's okay. Then we need to hear from you, and we need the month and the year. And the provider can use that to update the clinical reminder and capture that care. And so right now, we have a lot of the care that's not captured, and we want to change that for FY 2026. In addition, we will be providing more cervical cancer screening care. And that's all that I have. I'll turn things back over to Kathleen. Thank you.
Thank you, Dr. Pittman. So the next slides are about our maternity care program. And so the VA offers maternity care for our pregnant women. And although we don't deliver babies at the VA, which is fine because it's such a specialized care and our women are spread out so far, that we do pay for the OB care in the community for our women veterans. And so there's 2 sections. There is the maternity care for when our women veterans are pregnant, and then there's also the postpartum care. And so we will cover things for the pregnant women that will have to do with prenatal care, delivery. Afterwards, in the postpartum program, it'll be the postnatal care for up to 8 weeks. We want to make sure that our women veterans have access to breastfeeding pumps, nursing bras, and breastfeeding supplies if they are going to breastfeed. And we also cover the newborn child for the first 7 days to allow time for the mom to ensure that there's coverage for them. So with our maternity care team, we have our prenatal maternity care coordinator, Miss Kimberly Habersham, who is an RN. And then our postpartum team has Adrian Crawford, who is a NP and a lactation specialist, and also Zakia Moore, who is an LCSW. So we have a great cohort working together with our women veterans. So we have a flyer for anybody interested, and this will tease out a little bit about the Women's Program Maternity Care benefits. And it'll have basic questions about what is covered, where do we get our OB care provided, and then also it talks about the postpartum program, which will include the 12-month postpartum coverage that has calls and social support. Dr. Pittman discussed earlier how it's important to have people help navigate some of your care. And we've noticed that when some of our pregnant and postpartum moms have had health issues and challenges, it was extremely beneficial having these points of contact to ensure that their care in the community was accessed quickly and that we were able to support them in their services here, including mental health or social services or whole health or what other programs that they were still utilizing at the VA. So when we're looking at the postpartum maternity care program, it is now a new addition to our previous programming, and it will cover 12 months postpartum. And this program was designed because of a lot of the maternal morbidity and mortality that we noticed with women. And then also in the Southeast, the numbers are even higher. And so being aware of that, we've really worked together to get funding. We have wonderful support from our administration here to continue to grow this program to help support the over 500 women who are currently in our maternity program. So the services include comprehensive care. We do perinatal assessments, complete psychosocial assessments, care coordination. We work with medical and surgical healthcare services, lots of psychosocial supports, mental health needs, and any kind of support that our women veterans need. One of the things that we've noticed is the amount of housing challenges and food insecurity that some of our new moms were facing. So working with those different services within the VA has been really instrumental in improving health outcomes. Our postpartum maternity nurse practitioner and social workers serve as knowledgeable experts that will help during that time, that very vulnerable time for these women veterans, and also to help educate the different staff in the various VA programs that are working with these women. We continue to see more and more pregnant and postpartum women. We want to make sure that the care delivered, especially in programs throughout the VA, is at the highest level and the most support. Here is the information for our postpartum maternity care coordinators, and that'll be that'll live forever on the site. But always remember, if you have questions about who does what in the women's realm, I can direct you accordingly. All right, so our next speaker is through the Reproductive Health Program, and it is Ms. Jana Pion.
So I am Jana Pion. I'm a PA in the GYN surgical service line. I am considered, I guess, the reproductive health point of contact for our service line. So I'm going to talk a little bit about kind of a three-pronged approach as to what the VA covers as far as reproductive health in the life cycle of a woman veteran. So birth control. We provide throughout primary care and GYN a full range of contraceptive options. Anything that's FDA approved is available through the Atlanta VA. Anything from condoms to prescribed birth control pills, patches, the NuvaRing, which is another form of combined contraception like pills and patches. In the GYN service line, we will put in IUDs, Nexplanons, which is a subdermal implant for almost over 99% contraceptive effectiveness. Also, in all of the CBOCs and surgical clinic, there is emergency contraception available, Plan B, for those mishaps of unprotected intercourse, to be able to get access to that without having to go to your pharmacy and asking the pharmacist to use the key to get that from behind the counter. Also, Depo-Provera is widely available in all the clinics. And we also offer permanent contraceptive options like tubal ligations, and for men, vasectomies. On to the next phase of the reproductive stage, family planning and family building services. The Atlanta VA, or actually all VAs, will provide infertility, counseling, testing, and treatment for all veterans, regardless of their gender identity or whether or not they have partners at all. When it comes to covering IVF, that is something that can be covered as well in certain circumstances. The VHA has opened up this availability to veterans who don't have partners, veterans in same-sex relationships, but they do still have to have a service connection that is causing their diagnosis of infertility. And Veterans may now be able to use donor gametes, which are eggs or sperm, and can also even use donor embryos. However, that cost is at the veteran's expense. But everything else would be covered if they qualify and are eligible for IVF coverage. Also, egg cryopreservation in cases of medical indications. So, in talking about the Service Act and the PACT Act, if you've been exposed to something and you potentially are going to lose your ability to make your own gametes, eggs or sperm, you may be eligible to have, before you have any surgery or any kind of treatments, you may be able to preserve your eggs or sperm for use later on. I do just want to mention that in 2022, the medical benefits package was changed to allow us to counsel veterans who are faced with an unplanned pregnancy, counsel them on their options. That was changed. We weren't able to do that in the past, and so in 2022, we were able to talk to veterans about what their options are as far as how to handle an unplanned pregnancy. And who to contact if you have any questions in regards to that or any of the things that we've discussed. You can always reach out to Ms. O'Laughlin, the Women Veteran Program Manager, maternity coordinators, the Patient Experience Office or the Patient Advocate, your PAC team, and then, of course, I didn't add on here, and I need to for our next town hall, your mental health provider, if you do see a mental health provider. We get a lot of referrals for reproductive options counseling and for contraception management. And you can always, if you can't reach one of them, you can always call the Women Veterans Call Center, and I've attached that onto the slides here.
Thank you so much, Jan. I appreciate it. And then you get to hear from Dr. Pittman again. She is going to talk about research.
Okay, thank you. So we are nearing the end. I think I'm the last presenter on the agenda, and we wanted to get in a little bit of information about research. About 2 years ago, the Chief of Staff, Dr. Norvell, challenged us to develop a stronger relationship with our research department because he understood the importance of us understanding or developing a better understanding for what's happening with women veterans, and being involved in the research is the way that we understand. And so to that end, I have, myself and Kathleen, we've dedicated ourselves to exploring more about research and women's health, VA women's health in particular. So I am delighted to announce that we are a part of the VA Women's Health Research Network. And this is a network that serves as a national resource for VA researchers and program office leaders to accelerate women veterans health research toward having evidence-based impacts on practice and policy. So our Chief of Staff is clapping over there. He's excited that we have this relationship. And so we are one amongst many. This slide depicts all of the VA sites that are involved in this network. And so we are involved in Georgia. We represent Georgia. And so that's really good. And then I just wanted to highlight a few of the studies that we are involved in right now. So one particular study that Dr. Ree called me about 2 weeks ago that she is trying to recruit more women veterans to be involved in, it's called the VA Impact Study. And it's a research study that involves looking at patients with pre-diabetes and trying to determine they have pre-diabetes and cardiovascular health risk, and trying to determine if a medication that we've known about for years called metformin will help to prevent additional heart attacks or additional strokes. And so she wants us to help her recruit for this. And I would like to do that for her because I am the Women's Health Practice-Based Research Network site lead, and my job is to expose us to this information, to educate us about the availability of this information. So here you have a QR code to scan, and there's a coordinator that will reach out to you and discuss if you meet the criteria for this particular study. I think it's really a great study because it's a medication that's been tried and true. We know about metformin, and if it does truly decrease heart attacks and strokes, that would be wonderful to know about. And it may also lead to changes in practice patterns regarding how we use metformin. Typically, we use it mostly after we know that there's a diagnosis of diabetes. But I don't know how the study's going to turn out, but if it does turn out that metformin is effective before you have the development of diabetes, that would be amazing. So just please keep that in mind and feel free to reach out. They're really nice to talk to if you reach out to them. And then the other study that we received approval from the Chief of Staff about 2 weeks ago to be involved in is the Wisdom Study. And this study is looking at breast cancer screening and what is the best way to achieve breast cancer screening. Right now, the way that we achieve it is mostly the primary care doctor reviews the risk with the patient and asks, have you had your mammogram if you're 40 years old or older? But this study looks at, is there another way for us to engage our women veterans in determining who best to screen and how often to screen? And so it's not a study that's isolated to VA. It's actually a study that's across the nation. The goal for this study is to enroll over 100,000 women, and we are delighted that veteran women will be included in this study, and not only veteran women, but veteran women from the Atlanta VA will be included in this study. So that's pretty awesome that we're a part of this, and we will find out over the years to come what the outcome of this study will be. And so those are two studies that I just wanted to highlight that show that we are vigorously pursuing involvement in research. Now, we know that sometimes when we think about research, we think about, wait a minute, are they using us as guinea pigs? What's happening with that? And we want to debunk that myth. Of course, we know that there has been a history in the past where research was not done well, or that was it was mired in controversy, and there was a lot that was involved in the past, especially in the South. But it is our hope that that does not that history, although it is important and it is acknowledged, it is our hope that that history does not dissuade us from moving into the future and being a part of studies that could positively benefit the lives of our loved ones or our lives and the lives of veteran women. It is imperative that we involve ourselves in research, that veteran women involve themselves in research so that we can find out if medications work well for veteran women or if it doesn't, so that we can find out if certain procedures work well or it doesn't. So this is where we are, and everybody knows we're in the information age. We've got AI coming. One of the things about AI, artificial intelligence, data out is only as good as data in. And so guess what? If we're not represented as a part of the data in, then some of the data out may not apply. So we got to get on board and get the data in so that we can have effective strategies for care of women veterans. So that's all that I have to say. Thank y'all for listening. Back over to Kathleen.
Thank you, Dr. Pittman, and I'm so glad we were able to talk about that research piece. We know that there's gender disparity and racial disparity in healthcare, and so having opportunities here to really be able to address some of those issues and to be relevant in these studies is really an honor. And thank you, Dr. Norvell, for making that happen. Okay, so this is the time when we want to hear from our veterans. We purposely have our Women Veteran Town Hall because we heard you when you said sometimes when you go to the regular town halls, you feel drowned out with some of the other issues, or that you're with such the minority in the audience. So right now, I'm going to first go to this audience here, and then also we'll go online for who might have questions for us. So, any brave folks here have any questions in this audience?
Oh, I'm sorry. You mentioned that you're proud of the number of women being treated by the Atlanta VA. Are the services adequately being extended to keep up with the number of women being treated? If so, where are they being housed? How are they being dispersed? Um, is it being equally shared around the Atlanta area as opposed to all women veterans having to come to Arcadia or the main hospital for care that's pertaining to women? And I do have another question.
Okay, well, first of all, thank you for that question because that is very relevant. We know that when there was job cuts and when our number of veterans continued to expand, especially here, we're very fast growing, that we struggle with making sure that we have enough providers and staff to meet the veterans. So that's a legitimate issue, not only at the VA, but in healthcare in general. So our human resources and our chief of staff have been working diligently, constantly trying to hire more people, and then really working with administrations to make sure that we can bring in as many providers as we can to meet that need. So even though some places are having to cut providers, we're really working hard to add to our numbers. Regarding the location of them, so adding PAC teams in all the different CBOCs. We continue to have more CBOCs. We don't want the veterans to have to come here, to come through the traffic, to come deal with parking and things. So the providers are being added at the different CBOCs so that we're able to increase the capacity so that new veterans aren't told this is capped there. They're opening it up so that there's more veterans being seen closer to home, which is our ultimate goal, to make it more convenient. The reason that they have the Arcadia Clinic is so that women have the opportunity to go to a place that's just suited for women. I wish we didn't need that because I would love to say every single place that all of our CBOCs, people are going to be so comfortable going. But sometimes when they are 8 men in the waiting room and they're the only woman, that could feel uncomfortable for some women, especially women who have experienced trauma in their life. So we wanted to create the space there, and we are looking at creating additional spaces that will address the privacy, dignity, and comfort of our women veterans. So please keep asking that question to hold us accountable because we are always asking for that. And when our women veterans are saying this is what we need, that echoes even stronger for us.
Ask my other question. I wanted to go into something that you mentioned about losing staff. And maybe I should ask it of the director, but what is the VA doing to make sure that the staff feels protected and valued so that there is not that loss? I know that a lot of the angst and things that maybe the staff is feeling came from outside of the Atlanta VA, but at the Atlanta VA, what's being done to make the staff feel, again, valued and protected so that veterans like myself don't wind up without a primary care physician because now I don't have one. And that's an issue for me.
And I am sorry that you're experiencing a change or a loss in your current primary care doctor. That is very challenging for people, especially when they work really hard to build a rapport with their providers. And then when the provider leaves and they have to start all over again with somebody new. So I'm sorry that you're going through that. I really do want to, and I will let other people answer this as well, but I do want to remind folks that even when their provider leaves, they still have the rest of that PAC team. You have your social worker, your mental health coordinator, your nutritionist, your pharmacist. So if you hopefully can have a rapport with some of them to fill the gap until you get your new person in, I would hope that that would be a small sense of support as well. And as a staff, I know that there have been, whenever we go through growing pains and whenever there are changes that impact both the staff and then therefore the veterans, it is very difficult. And fortunately, our administration is very transparent with here's what's happening with budgets and with hiring freezes and really advocating so that we don't get cut and really advocating that all of our positions are considered essential so that we're not losing people, and then our veterans are feeling the pain of that. But I didn't know if Dr. Norvell wanted to address that as well.
So first of all, thank you for both questions. Because the reason that I come here as the chief of staff is I have to advocate for the resources that are needed. And with our women's veterans population growing, we have to make sure that we have the resources that we need. So with me is our acting deputy medical center director. This is Ms. Angela Morris. She also sits on our resource management committee. So there are things that we're looking at. Number one, from what we call a feasibility study. A feasibility study is how fast this VA is growing and where do we put the resources? Do we do a women's only service line? Do we put our tier 3 women's clinic in other locations? Because we're very spread out. One of the things that we did when we looked at our feasibility study is that the majority of our veterans are outside of 285. In the North Quadrant, in the East Quadrant, in the Southern Quadrant, they're all, exactly. So this is our time to look at that and to kind of retrench. So we're bringing it in, we're looking at it, and we're focusing the limited resources in the right place. What have we done for our staff to make them feel safe? Well, currently in our community, there are a lot of shootings and things that are going on. The first thing we looked at was, is this facility safe for you to enter? We've had some bad outcomes, so we had to really look at how do we help our employees to feel safe to come to work. And so we got together as a team. It may have been a little inconvenience, but we did have to put in a weapons detection system. I hate to say that a hospital is a place where you have to do a weapons detection, but our culture is changing. The other thing is getting out and speaking to the staff. We learned that you have to get out and you have to walk and you have to talk. And if a provider is leaving, why are they leaving? Is it because they think the workload is too high? Is it because they don't have some resource that they need? We always say money is a driver, but money is not a driver for a lot of the people that come to work for the VA. So it's really, how do you build that community and how do you figure out what is happening? Those are the things that we're doing to kind of, in these times, because you're right, things are so uncertain in central office, but we have to understand that our focus is on the veterans that are here in the Atlanta area. And we have to work as a team to make sure that we deliver you the best care and put the resources in the right place.
Thank you so much, Dr. Norvell. So to add to that, Dr. Norvell advocates on a daily basis for the resources that we need, not just for our vets in general, but definitely for our female veterans, as we recognize that you guys are one of the fastest growing populations, a part of our healthcare system. With that being said, we do recognize that we do need to continue to hire for our primary care team, and we are actively engaging in that process, making sure that we're looking at all of the different variety of ways that we can bring in new physicians and also retain them so we can keep them and continue to grow our program, because we have dedicated staff that's a part of the vision, and they want to make sure that we are doing our best, our very best for our female heroes that served. In addition to the safety of our employees, Dr. Norvell touched on like the physical safety aspects, but you do know that, since January, we've had a bit of a rocky road. So we strive on being very transparent with our staff, sharing with them what we know and what we can do that's within our realm of control, like hiring our providers, like making sure that our CBOC locations is very welcoming to our female veterans, making sure that we are addressing the needs on the main campus, looking at resources that we can expand, partnering with our affiliates such as Morehouse and Emory to make sure that if we can't do things within our walls of this campus and our CBOC locations, what can we do out in the community as well? I am extremely dedicated to our nation's heroes, especially the female veterans, because I started my career in women's health. Women's health is very passionate to me, not just because I am one, but also there's so much that we bring to the table. You guys fought on the battlefield, but you also had to serve as CEOs of your own households, and that's no easy feat. So I just want to thank all of you guys that's here today, as well as the people that's online, and I encourage more questions for Dr. Novell and myself.
Number two, the statement was made, women veterans belong here. One thing that has plagued my mind for years is why don't we have in-house breast care services? Forever, I've been going to community care for breast care services. We all have them or had them, all women. But we have to go somewhere else to get a mammogram, to get an MRI, any type of breast care. And that just is mind-boggling to me. There used to be a dedicated bus here at the main hospital. Then we were at St. Joseph's. Now I'm at a neighborhood hospital in my neighborhood, but I have problems getting my records sent over to the VA. I have always said I value my care at the VA. I have excellent providers. I've had Jana Payan as a provider. I love my providers at the VA. But when they send me out to the community, it sucks. So if we belong here, that's something so seemingly to me, because I don't know all the logistics, but we do have a radiology department. Why can't we get a mammogram?
I'm gonna need you to be on my advisory committee. See, because that is one of the things. So as you stand here, you are doing the same things that I do as the medical chief. And I have to tell my administrative people, we have to start mammogram. I said, we have the largest female population. Why don't we have mammogram? Why is it we can't get those records back in here? So we actually hired a breast mammogram technologist. We have a mammographer, and we are going down that pathway. When I said the feasibility study, you have to look at the resources and how you roll them out. So we are looking at that. And one of the things that we're going to be asking you for is to help us to get those initial records back in, because you don't want us to just do a mammogram on you and try to read some. We need those previous records to do. So that's the first thing that our mammography technician is doing, is she's sitting down and she's like, okay, when we start this, I need to make sure that I have at least 2 years, if not 4 years. And Dr. Pittman is putting her head down because she's been on these groups with me, because the first thing we want to make sure is that we don't go into a screening mammography without having prior films to look at. I need to know what your body looked like 4 and 5 years ago before I start just saying there's a spot there. So we are embarking on that. When I said the feasibility study, this new leadership team has gotten together and we said, okay, what are we not providing? Where do we need to go? What are those things? So you are asking all the right questions. I'm so happy I came today because, number one, Dr. Pittman did what I asked for. I said, it's not only what medicine looks like now, but what will it look like in the future? And that's what research is showing us. We know that a lot of our female veterans that are coming back now are getting breast cancer at a younger age. She showed us when she showed the doctor that had gotten breast cancer at 30 and died at 42. We're seeing that. And so how do we take those things that we know are happening and bring them to get the best care? That's why I wanted Dr. Pittman to involve in research, because as we start to go down here, it's going to be, what is the best care, doctor? It's not what you're getting in the community. What is the best care? So thank you for all these questions, because it helps us as a leadership team to keep going down the path that I think you're asking for and that we need to deliver.
And I just want to add, I know I'm not jumping the gun, and I hope I'm not, is that within our next fiscal year, so our fiscal year starts October 1, within October 1, in 9/30, that's the end of our fiscal year, we're planning to start at least mammography screening at our facility. So we have the equipment, it's at our ABC location. As we get things stood up, we will be communicating that to you guys via our communication platforms such as this with the town hall, and also, online as well. So, and our goal is to be reaching out to our female veterans to say, hey, guess what? We're ready. Are you ready? So be on the lookout for that. That is still in development, so I don't want to give you a concrete date just because we're trying to, firm up some of the details, but stay tuned. That is underway. Thank you for your questions.
Good afternoon, everyone. So I also have two questions, and one is kind of detailed first question. And so the question is this: what type of regular and reoccurring women's veteran programming is available for women vets that's non-medical? Now, I understand that a lot is done for pregnant veterans with baby showers and addressing, maternal mortality. But there are a lot of other women veterans on a spectrum, and a lot of outside organizations provide programming. But what is available from the VA, and what type of funding is also available for that? And do the veterans that are non-employees, what type of input is available to us? That's the first question. And also, has anything with DEI and inclusion affected any of our programming with this administration?
Okay, so I'm going to try to remember things, so you might have to pipe in to keep me on track. So regarding the offerings, you're absolutely right. We have really increased our maternity offerings, but that's just one small segment of our population. What we did just start, and the first one's going to be October 22nd, and I just am working on the details. We're starting a monthly meetup, and that'll be for women veterans the fourth Wednesday of the month from 12 to 2 at the American Legion near us here. Now, what we've been doing is in our focus groups asking our women veterans, what are some of the things that you would like to see more information and support around? What we've been hearing about is menopause, change of life issues, pelvic floor information, breast health information. So we have different topics that we're looking at. So each month it'll be like a different topic, but it's going to be twofold, because not only do we want these to be educational fairs, but we also want them to be opportunities for our women veterans to connect. We used to be able to do more before COVID hit, and we really enjoyed having these opportunities for our women veterans to come together because they learn from each other. We have additional information that they can get about veteran service organizations that also are here to support. So we're really looking forward to that, and we're building that. In the VFW and our Voluntary Services Department, CDCE, are working together to start standing that up. So that'll be happening soon. I do ask for folks, when we put our flyers out about our focus groups that we do quarterly, to really, if you can, look at participating. And they are virtual. So we really do want to hear people with these kind of questions and concerns, because that's how we've been able to add different services, is when people have said, this is what I'm interested in, and I don't feel like we have it. We do have our whole health guru director, Dr. Brown Johnson, in the auditorium. So can I ask you to answer the part of the question that's about women veteran services that are not medical, but are more whole health oriented?
Yes, and thank you for that question, because I was sitting here thinking, oh, we have some, but we need more. But in whole health, we do recognize the need to have women's only groups. So we have women whole health introduction group that is, for all women, as well as the 6 or 8 week taking charge of my health and life, which is all women's group as well. And then recently, we have added 2 yoga groups that are women only groups. One is yoga for survivors of military sexual trauma. And then the other one is the yoga for pelvic and back pain, which I believe is also female, or all male groups. But that question, again, triggers in our minds, we need to do more. So I do appreciate that question.
Kathleen, I think we have some questions online.
Okay, I can't see it on
Kathleen, I
here.
actually don't have anybody who's entered a question online, but I'm going to try something new. There's a caller that we're going to try to unmute and see if we can get their question in.
All right, let's
So
try it.
for the caller with the 615 number, see if you can talk to us there. I tried unmuting, but I'm not sure it's working.
Can you hear me,
Okay.
Mr. Daly?
Yes, we can hear
Yes.
you.
Okay. I'm just trying to find out, is it possible to actually send the team's links? Because like we're listening and you put at the bottom of the flyer the audio conference information, and then it says that a Teams link will be provided, but we never get a Teams link. So when you're saying scan this QR code, we can't see a QR code because you only list the information for audio conference. But some of us do have access to Teams, whereas if you had the Teams link, we could click on the link and we would be able to see the presentations. So is there a way, and this is not just for the women's veteran town hall, but actually all of the town halls. You only list the audio conference information.
Kathleen, I can handle that one. So yes, when we post these on Facebook and so forth, or when we email, I'm encouraging to also send the join meeting link. And sounds like that's not getting out there. It's like you can see the number from that slide, but the link is like how we send a slide out. If it's on one of our social media forums or if it's on the Gov Delivery, then we need to include the link with that. And I'll talk with the digital content folks about trying to get that link there as well. Obviously, if it's up on a monitor, we can't really put the link there, but we'll see if we can work with the QR code in that case. But I will mention that going forward. That's very important that you put that out there. So thank you for that information.
Thank you.
And I had a couple questions that came to me on my phone, but were there any more in the chat?
You had a second question. We jumped on your first question so hard that I think we missed the second question.
Oh, thank you very much. So the second question is, I'll just kind of go back to the first a little bit. And one of the reasons that I did ask about the programming is because I've kind of been out of the loop for a couple of years. And that is because I was experiencing a health issue, a very extreme health issue. And so the second part of the question is, what is being done, or how do you address a veteran's concerns with a medical visit and not just the symptoms, as I was experiencing what is known as electromagnetic frequency sensitivity, hypersensitivity. And so from my experience, it was something that nobody here at the VA had heard of. Now, I know that there are at least a few people in this room that know what that is. Am I correct? But no physicians knew how to really treat me, other than I had tinnitus or tinnitus. And so they treated me for that, and I got my ears cleaned. But the other symptoms, as far as me being extremely sensitive, with electronic devices and just a whole plethora of things, it was kind of give you some medication for a headache and, that's it.
Okay, so what I want to do is it is 6 o'clock, so I'm going to answer this, and I want to just make sure that we're letting people know that the questions that are in the chats, we'll get to that after the hours. When you feel like your medical care is not being addressed, the Women Veteran Call Center, and I have these magnets and I have a bunch of information out there, this is a really great resource to have, because what they can do is listen to you and then find out, who do I connect her with? And the beauty of this is, if you're a traveling veteran and you're in a different state, they still can address that wherever you are. But if and when those questions still are not getting addressed to your comfort and satisfaction, then they plug you to me as well. And it's a time-sensitive opportunity for me to be able to connect with our veterans who have gone through, it sounds like you went through all the right resources. You went through your primary care providers and you saw different people and tried different things. But we definitely want to make sure that there is a safety net for our women veterans, and that's where the Women Veteran Program comes in. So I want to make sure that you have this and that you have my information, because we want to continue to address those things. And I really appreciate when people come here and they ask these different questions. I don't want them to feel that it's not being heard. So Dr. Norvell, thank you for reining us back in when we were moving forward quickly. So please get with me after this. And it is time to wrap up, and I thank everybody for joining us. And if there are questions that have not been answered, we will get to that in the box. Thank you so much, and good evening.